Hello and welcome, everyone. I'm Dr. Mariam Riz. I'm a medical coordinator and a trainer here in American Association. Welcome in filler lip injection free online webinar. I'm so interested to start the day. Today, I'll give you a brief introduction about American Association, who is American Association, our branches, and then we'll speak more about accreditation, and finally, we'll speak about our services. And we will start our fruitful day and productive day. So, who is American Association? American Association is international educational organization that is specialized in continuous medical education for all healthcare professionals all over the world by providing them theoretical and hands-on workshop, 30% theoretical and 70% hands-on. Not only that, but also we give training, event, consultation for the physician. We consider the pioneer in international continuous medical education. We are working through our offices in Delaware, in San Francisco. We are working through our offices in USA in Delaware, in addition to in Egypt in Cairo, also in UAE in Dubai. And soon we'll open our new offices in KSA and Jordan, Brazil. These are certified registered documents related that we have an office in Delaware. So let's move to another point. What about the accreditation? We took full accreditation from American Association of Continuing Medical Education that located in San Francisco in USA. Also, we consider the regional office of American Association of Continuing Medical Education here in the MENA region, which include Middle East and North of Africa. Also, we took full accreditation from Accreditation Council for Continuing Medical Education that has high standard of continuous medical education that located in Chicago in USA. In addition to Dubai Health Authority Accreditation and National Quality Institute that certified we are training center. Not only that, but also we took two ISOs. ISO 9001 in quality and management system and ISO 21001 in training and education. We consider 1 out of 5 organizations that took this ISO in training and education. So, summary, we are working through strategy. We are not working haphazardly, as all our scientific programs are checked and reviewed from our scientific committee that located in the USA that make sure and guarantee that we are working through the latest update and the latest guideline. Finally, all these amazing curriculum are introduced by our certified international speaker. Finally, you took your certificate with accreditation, so all of these points increase from our credibility. So let's move to the one of the most important one. What is the vision of American Association? We seek to be nationally the leader, nationally and internationally in the continuous medical education field. Why American Association was created? For healthcare professional continuous development, as your development is our concern. So here question, what is the continuous medical education, CME? It's the educational process to renew the clinical knowledge and the practical skills. It's the educational process to renew the clinical knowledge and the practical skills for healthcare professionals. Why? To support their communities. As in 1991, WHO World Health Organization tried to define what is the standard of continuous medical education, finally found meets the local community need. So we are here in the American Association, we meet the medical and local community need by providing professional practical medical training and the latest update in the academic medical training. Let's move to the one of the most important part is the cooperation. We made national and international cooperation all around the world. One of the national cooperations that we made was UNFPA, United Nations Population Fund, in addition to WHO, World Health Organization in Egypt, and the Egyptian Ministry of Health, in series of courses that provide support for all healthcare professionals here in Egypt, in addition to the international cooperations like World Society of Cosmetic Gynecology, Brazilian Academy of Cosmetic Gynecology, Bahia Foundation, International Menopausal Society, Iraq Medical Association, in addition to Jordan Medical Association, and in recently with the second team, also with Sharka Surgical Institute. All this cooperation is very important to support our vision. This is some picture of our beloved cooperations. Let's move to another part about service. So now I covered who the American Association, our branches, in addition to the accreditation, and what is the importance of accreditation. And finally, I get what is the cooperation that we made here in American Association. So let's move to the last part here. What is American Association service? We offer diplomas and courses, training, conferences, in addition to free online webinar in different fields like obstetric gynecology, dermatology, surgery, and internal medicine. Today, I will speak more about dermatology and surgery part. We offer breast augmentation professional diploma. We trained more than 100 doctors from all around the world. And this is some picture of our graduate doctors. In addition to fat and nano-fat augmentation professional diploma, we trained more than 300 doctors from all around the world. And this is some picture of our graduate doctors. Liposuction and body contouring, we trained more than 200 doctors. Hair transplantation, we trained more than 100 doctors. So what about dermatological courses? We offer aesthetic medicine professional diploma. We train more than 4,500 doctors from all around the world. And this is some picture of graduate doctors that attend this amazing diploma. In addition to some master classes, like master class of filler, we train more than 100 doctors, master class Botox, master class of threads, in addition to hair aesthetic professional diploma. Our course is not here only in Dubai, in Egypt, but also in Dubai. We offer aesthetic medicine professional diploma in Dubai, in addition to master class of filler. Courses. Also, we not offer only courses, but also we offer something called conferences. We made in 2021 a conference called BDG, Professional Doctor Gathering. Professional Doctor Gathering that gather beginners, experts, and the pioneer to share their expertise and learn more from practice professionally by watching dermatologists and the plastic surgeon. It's like Confu course. So what does it mean of Confu course? Confu course, it's like course in form of conference, systemized program. Actually, the PDG Professional Doctor Gathering covered more than 1,000 attendees from all over the world. And this picture of our reputable instructor, Dr. Khafir Piet from Spain, Dr. Bassem Barsoum, Professor Bassem Barsoum, Professor Ahmed Sharif, Professor Tahar Al-Haita, Professor Ahmed Abu Leila. So let's see a video about BDG Professional Doctor Gathering. What happened in the Art of Filler Injection Conference.
أنا دكتور ياسمين صبحي.
I am Dr. May Naguib.
Bonjour, أنا دكتور
Hello, hello everyone. I'm coming again. Now I will speak about American Association Service. Also, we are not offering only training, event, and consultation for the physician. Also, we offer something called hubs. So, what the meaning of hubs? Hubs, it's online free webinar that we offer for all doctors from all over the world, not only for a specific region. We made dermatological hub called Aesthetic Medicine Hub is a free online hub, gather best experts from all around the world. Dr. Thomas Rappel from Austria was the honorary president, and also these gathered Professor Patrick Treaty, Professor Ahmed Sharif, Professor Basim Zaki, and a lot of doctors, reputable doctors. Actually, this hub attended more than 1,500 viewers from all over the world, and this some picture of our hub. It include everything about Aesthetic Medicine Hub, and you can watch it again in our YouTube channel. If you press the live section, you can find this hub 8 hour that gather all things about filler and Botox threats, in addition to complications, also the most trending thing and the latest updates and the latest guideline. This is some picture of American Association best moments. And finally, this is our YouTube channel, American Association. You can press to the live section and you will get any hub. It's like free online webinar that gather best doctor from all around the world, in addition to the most updated topics and the information in this field for free, 8 hours or 2 hours or 4 hours. You can attend all of this lecture if you press to the live section, and you will get your attendance certificate. And I will tell you something. There is a registered link here for certificate. We will put it in the chat box. You must fill it to get your attendance certificate. So today we will start with our instructor about filler lip injection. We will start the first lecture with our beloved Dr. Mahfij Naeem from Pakistan. She is a clinical dermatologist, specialized in dermatology at University of South Wales in the United Kingdom, fellowship in aesthetic medicine from the American Aesthetic Association in USA. Actually, we are. It's our pleasure to have Dr. Mahfij Naeem with us today, and I let you with the first lecture in our online free webinar with Professor and Dr. Mahfij Naeem. And let's start our day.
Hello and welcome to the class of filler lip injections. My name is Dr. Mahfij Naeem and I'm a certified clinical dermatologist and aesthetic physician. I have been in the field of medicine for the past 10 years. I am extremely thankful to Aesthetic Hub and Professor Patrick, Professor Ahmed, and Dr. Massimo to have me here to present the anatomy of lips to you. Lips are the most vital part of a human face. They can actually present you the true beauty of an individual. If the shape is perfect, it can give a striking look to an individual. The most important feature of a human face is their lips. Their shape varies from individual to individual, and they can be enhanced and reshaped accordingly. The perioral area and the lips itself can be affected by various things such as genetics, aging, UV damage, trauma, but these changes can somewhat be reversed and beautified with the help of certain treatments. But in order to achieve that, we first need to see what human lips are like originally, how they are shaped, what kind of anatomy do they have, what kind of blood supply, nerve supply, muscle supply, and features do they show externally. Let's look at the human anatomy of lips, which is basically their surface anatomy, and it shows on their face. If you look at the lips externally on your face, basically they'll have different parts. We can start with the vermilion, which is the redmost part of your lip. It's red because it's rich in blood supply. Then we have the vermilion border, which is a thin pale skin that separates your side of the lips from your facial skin, often known as the border of the lip. Then comes the cupid bow. Cupid bow is basically visible on the upper lip or the upper lip vermilion. It has elevation on the sides forming a bow and a depression in the midline. This is the most common side of enhancing lips, even with your normal pigmentation or your lip liners or your lipsticks. Then we have the philtrum, which are two vertical columns of the tissue extending from the upper lip, forming a midline depression ridge under the nose. Often they depict the size or the width of the cupid's bow. The tubercle is the most plump part of the lip, forming a V shape. If we come to the lower lip, we can see that it's mostly densed with the body of the lip. Now on the outsides of the lip or the borders of the lip, we can see the nasolabial fold extending from the under of the nose or the sides of the nose, depending on how much you have aged, your features and your facial anatomy, extending towards the side of your face, of your lips, forming a fold meeting your borders of the lips. The border of the lip where the upper and the lower lip meet are called the oral commissures. When they sag, they form meridional lines. This is another fold on the lower part of the lip over the lower lip, which basically is the angle between your lower lip and the chin. This can also be enhanced with the help of Botox or fillers. This is basically the visual anatomy of a human lip, and you can enhance or give shape to all these areas, giving a proper look to anyone's face. We can inject Botox and fillers in various parts of the lips and around the lips to give a very plumpier or a nice look to anyone's lips. Often nasolabial folds, mentolabial folds are often enhanced when we're trying to inject lip fillers so that we can give a very nice shape or a very beautiful look to anyone's face. Let's look at the basic lip muscles. The muscles of the lip are basically the muscles of the mouth. They are responsible for the movement of the mouth, and with the movement of the mouth, you can actually see how the lips are moving. The first muscle we're going to discuss is the orbicularis oris, which is also known as the sphincter around the mouth and the chin. It has been supplied by the buccal and the marginal branches of facial nerve. It helps in forcing dilatation and the closure of the mouth. The next muscle is the depressor anguli oris, extending from the mandible to the depressor labii inferioris, supplied by the marginal-mandibular nerve of the facial nerve, and it also helps in depression of the angles of the side of the mouth. Then we have the mentalis, extending from the mandible to the dermis of the chin. It helps in elevating and protruding the lower lip. Next is the depressor labii inferioris, extending from the mandible to the mandible foramen, and levator labii, extending from the maxilla to inferior infraorbital foramen to be inserted into the upper lip. It's often accompanied by levator labii superioris and alachinasi. Its action is to elevate the upper lip. Levator anguli oris is the next muscle extending from the canine fossa to the upper lip. It helps in elevation of the corners of the mouth. These muscles are important to be kept in mind while we are trying to give human face a look that will be more attractive, because all of these muscles can be enhanced, or their functions can be enhanced or decreased depending on the injection of Botox. And Botox and filler, while giving a combination treatment, can show extremely enhanced features of a human face. Next, we need to keep an eye on the arteries of the lips. This can be a little tricky because facial artery supplies the whole face, and we need to know where the superior and inferior labial artery, which are the branches of the facial artery, depending on the injection of the lips. The depth of these arteries depend on humans. It varies from one person to another person. So every time when you're trying to inject a lip filler, you need to make sure that you actually retract your plunger to see if you have pierced this artery or not. Because injecting fillers into arteries can be really damaging for the patient. So this has no hard and fast rule, so you need to be dependent on your clinical skills. If you look at the cross section, you will see skin, subcutaneous fat, submucosal fat, circumferential muscles, and oral mucosa. Now you can achieve various types of lips depending on what your patient desires or what kind of look they're looking for. What makes a lip beautiful? Ideally, what we would like to achieve is a ratio of 1 to 1.618, a balance between upper and lower lip, symmetry between right and left sides, fullness in the centers that tapers at the end, a pronounced cupid brow, a well-defined vermilion border, and corners should be facing upwards. So you need to keep an idea of what kind of lip shape you are looking for. Often patients come to you and they have an idea of Russian lips or angel lips or whatever kind of lips they want to achieve. Sometimes they have a picture of a celebrity and they want to have lips like that. So you need to sit down with your patient, have a discussion before injecting anything. Humanly, the different types of lips, like full lips, too heavy full lips, bottom heavy, broad lips, small round lips, heart shape, bow shape, depending on anyone's personal anatomy. But yes, because of the enhancement in the face and advancement in the techniques of lip fillers, we can now achieve different types of shapes. In the end, I would like to thank everyone for joining this presentation with me, and we will wait for the question answer sessions in the end if you have any. Thank you so much.
Hello, everyone. Come back. Really, I wanna thank Dr. Mahfish Naeem for this amazing and informative lecture. If anyone has any questions that want to ask Dr. Mahfish with us today, and we will start our discussion about the anatomical part of lip filler. And now, Dr. Mahfish with us. Thank you, Dr. Mahfish, for this amazing and informative lecture. Was all heartful.
Hello, everyone. Questions over here for the lip fillers. First of all, let's talk about the medical indications for lip fillers. For first and foremost, obviously, if your patient comes with a deformity or they just ask to do that. With age, some people actually they figure out a loss of volume around their nasolabial folds or in their lips. Then you should always do that. First and foremost, to just get a lip enhancement done, go ahead, do it. If they want to reverse the sign of aging because they will see some sagging or wrinkles around the lips, you have to do that. The second question is complications can arise due to various technique flaws or patient to patient verification, like bruising, infection, swelling, nodule formation, and if you are in an artery and tissue necrosis. Then there's a question about what kind of depth you should achieve. I think that 30 gauge needle with 2.5 millimeter, that's the depth you would like to go with an angle of 30 degrees. We'll go into the danger areas. Danger areas is the next question which we have on the list, which basically are the lateral side of your lip, the lip liner, the philtrum columns, the orbicularis oris muscle upper lip. Then the next question which we have is how to minimize lip filler migration. I would like to suggest you to go slow. Gradual enhancements will actually help you achieve better. The last question is like, what muscles would be injected? We don't usually inject in the muscles. We stay in the submucosal area. Submucosal areas are the best areas to go in. You shouldn't never go deeper than that because and the best technique will be micro droplets. That's about it. If anyone has any more questions, please let me know and I will glad to be answering all of them. Thank you.
Thank you, Dr. Mahfish, for this amazing lecture and for the discussion. Actually, there's one question in the chat box. There's someone who, if we have it on the lip, can we elevate it with a filler?
Can you please repeat the question? Oh, the size of the needle. The size of the needle will be 5 millimeter. You would like to go at an angle of 30 degrees. So avoid going very deep. Go with very micro droplets of your fillers. Start molding it and be very, very small. Don't ever overdo it. So the better you stay on the safer side, it would be giving you much better results instead of going with a lot of filler at the same time.
Okay, there's any question for Dr. Mahfish? This is the last chance here to ask Dr. Mahfish with that. Okay, and now after finishing this amazing lecture about the anatomical of lips, we will start with a new topic about the different techniques with Dr. Massimo Vitali. And then I want to thank you, Dr. Mahfish, again for this amazing lecture and this amazing discussion. And we'll start our next part with Dr. Massimo Vitali. He is one of plastic surgeon in Italy, private practitioner and general doctor in Tanvala, international congress speaker, national and international trainer and speaker for filmed laboratories, MERS, aesthetic, questionnaire, and the glazer. Hello, Dr. Massimo. How are you? Hope you're doing great.
Hello, good morning, good evening.
Good morning.
Here is morning. So I will share my screen. Okay. So can you see my screen? Everyone can see the screen? Yes?
Yes, Dr. Massimo, everything is clear now, and we can see the screen.
Okay, so thank you to be here. So I will speak about different techniques of lip injections, and every time I speak about lips, I like to start the presentation with these quotes, because the perioral area and lips plays a primary role in the expression of the emotion. So lips are very important for the attractive force of our face. So there are many kinds of lips, and every single modification that we do in our lips can have a huge how can I say impact in the face of the people. As you see, I often use the example of Angelina. That you can imagine Angelina with her nice lips, and you can imagine it without the lips. Is a total different face. So sometimes the lips can represent a real ID. So lips are the signature of the face and could identify it. Okay, so a small change in them can have a strong impact of the personality of the entire face. So maybe the anatomical part was related before, but I just want to refresh some anatomy, and it's very important to keep in mind that we can have some anatomical variations about the vascular part. So it's not so easy as we know, but we know that there are some variations that we need to keep in mind. So I I put down here in the presentation new papers that describe the variation of superior labial artery and inferior labial artery patterns. This is the distribution of the of this study. I will not lose time in this part, but I want to show you these papers. This slide is about the depth of the superior labial artery in this portion of the lips, and this is very important because this is the bifurcation of the superior labial artery when born from the facial artery. So this point is about 15 millimeters from the corner of the lip. So it's very important to keep in mind that the superior labial artery starts from here. Maybe when you use a cannula technique, but we see it better now. And this is another study. Okay, so you see, it's very nice, this study, because you can see other topographic distribution. So I invite you to search it and to read it. And also then the inferior labial artery has some variations. So it's very important to keep in mind this, because maybe if you inject in some point of the lip, maybe you can have in base of the distribution of the pattern, you can have problems in other part of the face. And maybe from the anatomical part, this is for the anatomical part, this is maybe the most important slide, because you see the depth of the superior labial artery, which is in the most cases is deep. It is very deep, is submucosa. So we can resume that the injection, the superficial injections in a subcutaneous layer are the most safer injections. And this is a resume that I told you in this moment. So my advice is to keep it superficial injection, but we see now here I will show you some of papers that describe the most important techniques. If you search on PubMed or other site, you can find a lot of papers and techniques. So I will show you the most important for me. This is 4-point technique for lip augmentation. This author described this technique with 4 points, with 4-point entry access using a cannula, dividing the part of the lip and using a submucosa, so deep bit, because they use a cannula and injecting boluses from point 1 to point 4 and treated the whole lip area. I personally don't like too much this technique, and you will understand why. But this is one technique. Other technique that's very famous is the not touch technique, because this is a cannula technique. This is a very safe if you are looking for a safe approach. This is for sure this is a good technique because using a cannula you can avoid vascular problems, and you can also are able to do good shape for the lips, but in my opinion is less artistic from needle technique. This is other technique. This author recommend a 6-step technique because he's doing the reshaping of the philtrums, of the cupid bow, of the vermilion, pinching and injecting in a different part of the way of the lips. It's a good technique, but in my opinion, he's doing a lot of injection, approximately 12 injections. So it could be quite, let's say, invasive, but more injections you do, more problems you can have. Is you could have, because and it's possible obviously more bruising, more risk. It's a good technique, but I think we can do better. And this is another technique that this author proposed a minimalistic approach for effective lip augmentation. So this author proposed to inject linearly retrograde from the vermilion border in submucosa. Okay, so very deep. We said before that our vessels are deep in most of the cases in submucosa. See, this is a good technique, but in my opinion, is very is more risky. Okay, and this is a let's say new technique because Dr. Lee Walker published it in 2021 using a 4 millimeters needle for the injection in the of the upper and the lower lips using a retrograde technique. Yes, I think it's a good technique because the layer of the injections is subcutaneous. The techniques needs to perform a lot of injections along of the vermilion border to create a good shape of the lip. But I smile because okay, this is a new published technique, but unfortunately I perform it before, but I never thought to publish because I performed it in 2020 in 2018 and 2019, as you see. And this is I maybe I will show you a video. So it's very nice, it's very simple. You use the 4 millimeters needle, 30 gauge as a mesotherapy needle. So this is the technique of the Dr. Lee Walter, but I already performed it several years before. And now I will present my personal injection technique that I perfected a lot in these years. I call it MVU, Vectors Technique. MVU, like my name, Massimo Vitale, but actually because you you draw an M and an inverted V when you inject the lips, and I will show you. Okay, this technique is being published right now. So in a few months, I think you can find it in PubMed. Okay, in a paper. So my propose is less entry points. Okay, obviously with needles, not with cannula. Okay, less entry point. So in order to have less risk and complications. So the first access point will be in the middle of the vermilion border, let's say about 2 millimeters to the cupid bow, and in a linear retrograde way you perform the first vector. So without exit from the access point, you change the direction to the middle of the lips. Then you can go back and do another vector. It's like about the Russian lip, but it's not the Russian lip because the Russian lip do some vertical vectors. Here we are performing horizontal vectors to create a natural volume, projection, and eversion. So with one single access point, actually you can reshape the entire lips mucosa. The layer here is subcutaneous, and then if you need, because this is the red threads, the red arrows are mandatory, and the blue one are optional. If you need to treat some a lateral zone because you need to improve the volume or the shape of, maybe correct some asymmetries, you can do it. And it's the same. Okay, the quantities here could be also reduced. In my experience, it depends of the lips. If I thin lips or normal lips, I don't know, and in base obviously of the result that I want to do. create, but maybe I can use the whole syringe of 1 ml, or maybe I can use half of syringe or 0.3, I don't know. But this technique allows also use small quantities of filler, and then I will show you some cases. And for the lower lip, it's the same. You perform with one access point vectors, vertical vectors, in retrograde injection, and then you can move immediately at the side and you perform other vectors. So this is technique is less painful for the patient, less invasive, and allows to you to do a very good job and a very good reshape of the lips, maintaining the curvatures and a natural symmetry of the lip. So this is a work in progress case. You see, this patient had hypertrophic mucose and some asymmetry of the upper lip. The treated lip, you see how the volume and the shape is improved, and also only with one access point from here, doing linear fading and a fanning technique. Only one access point. This is the patient 1 month after the treatment. You see very difficult lips, longer lips with asymmetries and a hypertrophic mucose. This is the after 1 month, and this is after 2 years. You see, when you inject the filler in the right position, and a good filler, obviously, the filler could integrate very well with the lips mucosa and stay long time. Okay, so it's a myth, it's a legend that fillers last only 4 months or 6 months. I have a lot of cases above 1 year, 2 years of duration of the result. This is another difficult case. You see this young patient with several asymmetries and an inverted lip. So I treat the lips, but I also treat the nose and the chin. So it's our liquid profiloplasty, and this is the frontal view. You see how her face and her profile is more harmonic, only treating the lips. Obviously here I treat also, like I said before, the chin and the nose, but if you focus on the lips, you can see how her face is improved, only changing the lips. This is another difficult case. You see, this is like the first case that I show you, that with a very hypertrophic mucosa and difficult curvature of the lip. And with this technique, I can improve and I can reshape the entire lip area, maintaining a natural aspect. This is the frontal view, and the after picture was taken I think 6 months later. This is another patient. This is a patient. Actually, this patient is 2 ml of HA in the same session, but you see she had very thin lips at the beginning. And the first picture that you see here is a 3D picture with quantifier, and you see how her face is improved, and is changed, treating only the lips, a more fresh and youthful aspect of her face. This is another patient. I think is the last for this presentation. In the lips, she doesn't have hypertrophic mucosa, but she has small volume of the upper lip with actually with a good shape of the lip, but the mucosa was inverted. So what I did is to invert the mucosa with threading and fanning technique. Okay, and this is a work in progress. You see these aging lips with wrinkles, and this is only one side treated, and you see how with only one access point, like I said before, you can able to reshape the entire lip, and this is the immediately after. So we speak about cannula or needle techniques. So for me is absolutely needle, because you are very artistic, okay, and you can perform very artistic works, because we are doctors, and I think we are aesthetic artists. So my take-home message is a less is more approach, a very anatomy knowledge, and we are not perfect. So maybe we can appreciate also the defects, but the most important things is we need to understand, and maybe we need to do harmonic situations, harmonic faces, without exaggerations of the face. The perfection or ideal perfection that we see maybe right now in this historic period in the social media, I think doesn't exist, these fake faces, but it's very important to understand that we are doctors, we are we have patients, we don't have clients, because it's very important that we are doing medicine, we are helping people, and we are not creating you say like in a factory, every face the same. And it's very important to do a tailored therapy, tailored treatment. And this is all. This is my Instagram and LinkedIn account. So if you need some information, question, or debate for something, I will be happy to talk with you. Thank you so much.
Hello, thank you, Dr. Massimo, for this amazing and informative lecture. Actually, there is a lot of information, exclusive information, and special techniques. It's an awesome lecture about the different techniques and gather a lot of informative and exclusive information. I'm speechless after this amazing lecture. There is some question in the chat box. There is some attendees ask you some question. If you look the chat box, you will find.
I'm trying to I'm searching actually in the chat. So okay, the first question, okay, Thierry gauche needle. Yes, it's a Thierry gauche needle. 13 millimeters. So the classic filler needle that is provided in the box of the filler. Not more than okay. This is for maybe Naheem. Okay. Okay, when we okay, can you see a video for MV? Okay, right now it's not possible because I'm waiting to be published, okay, in the paper, but you see the diagram in the presentation. I think I have some very short clips on my Instagram, okay, but I will try to do it, but I'm not doing right now because it's very fresh thing, so I am waiting to be published. The layer, as I said before, is subcutaneous because it's very safe. It's very rare that you find important vessels in that layer. Yes, the filler stay up 2 years. If you see if you look in my Instagram, you can find that patient actually after 3 years. There are some pictures from her holding a magazine that is she's published in a magazine, so you can find her. The filler I use I think I can say the brand is not a problem. Yes, I can say the brand of the filler. I'm working I use Filmed Laboratoire, and I use the Lip Soft from Filmed. I'm using it since 2018. The depth of the injection, I say before, is subcutaneous. Okay. Safe period between lip filler and dental procedure. I don't think it's a safe period because maybe if you have to do some procedures for maybe you are taking some medicines, antibiotics of something, maybe you can do first that, and then you can worry about aesthetic concerns of the lips. The type of filler, what type of filler do we use for getting lip filler for the first time? I don't know how which fillers you have in your country. I don't know every brand, but I think Filmed is very well distributed also in Middle East, and maybe Filmed Lip Soft is very nice. It's very soft, so even for beginners, it could be very helpful. How to avoid complications? Okay, complications of maybe we can speak later about complications, but complications, you avoid complications when you respect the anatomy, when you respect the anatomy, and you inject in when you inject slowly, when you inject small quantities. I don't suggest to you to do boluses. Massage, and also using a right filler, because remember that the complications is not only vascular complications. You can have nodules. You can have maybe you could have infections if you don't disinfect or asepsy metals. So all of that. What is the space that we should leave between the upper lip and the nose? The size of the needle, and this injector method is vertical. Okay, the space that we should leave between the upper lip and the nose, there is not a universal answer because it depends of the patient's anatomy. So you need to see it in the moment, because you can have a European patient or African patient, so it's not the same. The size of the needle I say before is 30 gauge by 13 millimeters, and the injection method is both, is horizontal and is vertical. You do threads in both ways. I don't know Nubia filler, I'm sorry. Okay, how can I recognize if the filler is good? Bah, I don't know. My advice to you is use well recognized brands. So you have a lot of brands, Filmet, Teoxan, Allergan, Nubia. I don't know. When you have a great company behind you, you could feel safe. Yes, of course, the lip massage after filler is mandatory. What about Russian technique? Russian technique is similar of this technique. The main difference of Russian technique is that they do a lot of vertical access with deep injections, not superficial like here, using a filler with a high rheology and injecting a lot of product. So you can in that way you see that results are the lips are all the same, very plain and very big, all the same, like you do like a photocopy lips. So it's very different. The numbing lips, yes, okay. I use a numbing cream of lidocaine, and I don't know if like the cream that I use is available in your country, but I only numb the lips with cream. To bend the needle, I don't do it. I don't bend the needle. I am able to perform the injection without bending the needle. Unit we can use a filler. Okay, filler is not in units, it's in mLs. Personally, I can use the whole syringe, so 1 ml or less. It depends of the of the of the lips of the patients. Okay, it's not we don't have a limit of use. Okay, maybe you can use the whole syringe in one session, and you see the patient after 1-2 months, and maybe you can do you perform a second treatment or a third treatment to reach your goal. Okay, it depends. Maybe one patient I perform only one session, and maybe I need to do more sessions to create the dreamed lips. Does the filler become migratory lip? Honestly, I never had that problem. But in that case, you can obviously use a hyaluronic base, but I never happens in my experience. That's all the questions. Okay, no, there's another question. So no matter how I enjoy the fear in the middle part of the lip, the
Yeah.
fear just
I found it's amazing and interactive conversation.
yeah.
Sorry, Dr. A
Yeah,
lot of
yeah.
questions, yes.
Yeah,
A lot of people are interested about your lecture.
okay. How to overcome that? It depends. It depends of the anatomy of that lips. Depends of that filler that you use. Maybe you can try this technique in the lower lip, and maybe you can perform direct, very superficial in the mucosa, okay, to have a more plump effect. But like I said before, it's not a rule that you need to use only 1 ml syringe. Maybe you can have lips that you need more. So step by step, you perform a session, you do a treatment, maybe you see the patient a few weeks later and perform another session. So this is my advice to you. The needle size is 30 gauge by 13 millimeters.
Okay, I think there is no question else. So thanks, Dr. Massimo, for this amazing and interactive conversation with Adam Lees. It's our honor to have you in our scientific committee. I want to thank you again, and I'm speechless. I know that there is no words can describe how we are pleasure and we are so happy for joining to us today. And
Pleasure was
now
mine.
it's our pleasure, Doctor. And now we will continue our amazing interactive sessions, but after taking 10 minutes break to get your press and to eat something and coming in after 10 minutes with amazing lecture with Professor Ahmed Sharif about live educational video demonstration. And also there is, you can find this informative help in live in YouTube channel. If you can't join us now because of the room limited number, you can find it again in YouTube channel live, and you will take your certificate. And please fill the registration link to get your certificate after finishing the hub, as it is so necessary. We will send the link again, and we will take 10 minutes and come again with Professor Ahmed Sharif, Professor of Plastic Surgery, Faculty of Medicine, one of Egyptian icon in aesthetic medicine. Actually, don't miss this amazing lecture, educational live video demonstration. And after that, there is Q&A session. You can ask any questions that you want. So don't miss. And we will come again after 10 minutes. Don't go. See you.
كورس اللايبوسكشن and body contouring. الصراحة كان الكورس كتير شامل، غطى نواحي مختلفة من خلال فترة قياسية.
الكورس كان جميل ورائع، الهاندز اون كانت ممتازة جدا. احنا اشتغلنا على مناطق متعددة في الجسم، على الفيس والتشن، اشتغلنا على الابدومين، اشتغلنا على البريست، واشتغلنا على الثايز وعلى الارمز. الاكسبيرينس اوفرول كانت جود.
بكورس اللايبوسكشن and body contouring. الصراحة كان الكورس كتير شامل، غطى نواحي مختلفة من خلال فترة قياسية.
الكورس كان جميل ورائع. الهاندز اون كانت ممتازة جدا. احنا اشتغلنا على مناطق متعددة في الجسم، على الفيس والتشن، اشتغلنا على الابدومين، اشتغلنا على البريست، واشتغلنا على الثايز وعلى الارمز. الاكسبيرينس اوفر كانت جود.
الوضع جدا ممتاز من ناحية التجهيزات، من ناحية تعامل الدكاترة، من ناحية الحالات. كانت very interesting cases، والحمد لله توفقنا بالكورس. وبصراحة أنا أنصح أي دكتور يعني حاب أو هو انترست في هذا المجال أنه يلتحق في هذا الأسوسيشن.
بكورس اللايبوسكشن and body contouring. الصراحة كان الكورس كتير شامل، غطى نواحي مختلفة من خلال فترة قياسية.
كان محاضرة رائعة جدا، كان interactive، الدكتور كان يشرح وكان يسأل، ف it was very interactive و very interesting.
الوضع جدا ممتاز من ناحية التجهيزات، من ناحية تعامل الدكاترة، من ناحية الحالات. كانت very interesting cases، والحمد لله توفقنا بالكورس. وبصراحة أنا أنصح أي دكتور يعني حاب أو هو انترست في هذا المجال أنه يلتحق في هذا الأسوسيشن.
Hello, everyone. Again, we come back. And actually, are you ready for amazing and live educational video demonstration that will be presented by our beloved professor, one of Egyptian icon in aesthetic medicine, Professor Ahmed Sharif, professor of plastic surgery, faculty of medicine, Ain Shams University, one of member of Egyptian Society of Plastic Surgeons. If you're ready, we will start with our beloved Professor Ahmed Sharif. We'll inject live case lip filler, and if you have any question, don't hesitate to put your questions in the chat box, and Dr. Ahmed Sharif will be with us in the question and answer session. So let's start our educational video demonstration.
انا مش ظاهر على الشاشه. صحيح. ايه؟ بس كده. Assalamu alaikum. Good evening, everyone. It's been a pleasure listening to all the expertise, and I hope I can add something. Welcome, everyone. Great information, great knowledge. Dr. Masima, I don't know if you remember me or not, but we met back in 2015, and it was a great honor seeing you work and learning from your techniques in injection. Anyway, so I'm not gonna bother you with a lot of presentations and talks. I just want to do a quick demo. But before I do this, I just want to have 5 minutes of words, just in my little expertise, why I do inject lip fillers. And I find that the 5 main reasons, or probably even the 5 only reasons why women, especially women, 99% of them are women, why do they come asking for lip injections? Well, 5 main reasons. And one is they do it for correction of lip asymmetry. 2 is they do it for plumping. And I like the word plumping, not volumizing or thickening of the lips. And so it's just called plumping. So plumping of the lips, correction of asymmetries, contouring of the lips, and we have lifting of the lips, lip lift. And finally, it's correction of the lips in asymmetry with other proportions of the face, like the nose, like the chin, like the cheeks, the jawline, etc. So it's just putting every part or every piece of the face in harmony. This is aside from correcting just asymmetries within the lips. So you're correcting asymmetries around the lips, within the lips, you're lifting, you're contouring, or you're plumping. So these are the main reasons why we do lip injections. Now, another thing is I've seen people inject, and I used to do this, they can inject lips with cannulas just from the corner of the mouth. And I sometimes it's, if you don't have enough expertise or experience in this field, it's going to be risky because we are just traveling with the cannula in the pathway of the superior or inferior labial arteries, and it can easily be canalized. The artery can be canalized, and then there's a problem, especially that we know that anatomy is not always fixed in one area. It can change. And they always told us that the artery is usually behind the muscle, but in about 15% of people, it's within the orbicularis oris muscle, and in a few percentage of people, it's even anterior to the muscle. So it's just beneath the skin when we're starting to inject. And another thing is, are you going to inject longitudinally or vertically? It all depends on what you see is proper for each patient and what you want to do. Another thing is just recognize the anatomy, know what she's coming for. Whatever you can do well, then just go on for it. Inject very slowly, aspirate if you need to do this, and check for any signs of any color changes, any excessive pain. You know, there are early complications, there are late complications. We might be talking about this later on. And I've tried several techniques. Now, there's not just one technique for it. So anyone can have his own technique. It's just built on experience. It's built on knowledge of anatomy, and it's built on what you can do best. We all know that Dr. Tom van Eyck of Holland was the first one to pioneer ferning and tenting injections, which Julie Horn later then refined and then started doing her own technique. And she said it took her so many years to do this, injecting and then injecting things to dissolve the filler, waiting, or not, she's not happy, she's not satisfied until she reached her own technique, which a lot of people have learned from these two icons. And of course, you know, having the advantage of being a surgeon, which we do work on things like the cleft lip. So you can see the lip anatomy. When the lip is wide open in front of you, all the musculature in the arteries. And so it even gives me a clearer vision of what I need to do, where I need to place my my filler, and if this person needs just a filler or might substitute it for an operation, even a combination of both. You know, you can do an operation and you can do filling, and I do sometimes I do fillers, especially in certain people who I know fats is not going to affect is going to be of value. So sometimes I'd go for nanofats or even microfats injection instead of fillers in the lips. But these have special criteria to be fulfilled. Anyway, so I'm not going to talk much. We're going to shift now to what's the most important thing is assessment of the lip filler. So I'm going to do assessment, what she needs, what I see is beneficial for her. Then we can combine both opinions together. And the next step is, so what you can do to solve the problem, turn out with the most pleasable look. Now, natural look, I like the natural look, what has achieved what she's come for. And what I will do to say I got a good result, it's a safe result as well. It's a natural result. It will last as long as possible, following some instructions after the injection procedure, and then the follow-up and so on. And then after we finish, if anyone has any questions, I'd be delighted to answer. Thank you, and see you in a very short while.
Listen, man. All right, I'm just gonna show you something. So I always start off with the time down here. تيجي كده. So I always start with injecting the lips locally. I tried putting numbing creams on top so many times. It's not as effective as this. And I think dentists will recognize this needle. It's my own personal thing. And I always use it to give local anesthetics just before I inject. It really helps me inject when the patient is really calm. And I know how to do some local anesthetics of the lip. So I always start that way. All right. So I've started injecting her earlier. I'm going to give her a few more minutes, and then we're going to be on our way injecting. Now, once I do this, of course, I change my gloves because it's been inside her mouth, and I start doing my markings, which is a very important step. So I asked her what she needs, and she said she doesn't. The first thing she said was, I don't want any Russian lips. I want a rounded lips. Just wanted to look a little bit plump and do some fine contouring. So it'll be very lovely for her facial features. It's also matching with the rest of her face. We do just a little bit of contouring and very fine plumping. She said, I want a circular or a heart-shaped lip, which is the most pleasant looking, and it is as well very natural. So I start off just by doing my main markings. I don't know if you're going to see with the light or not. Can you see this? شوف يا شاعر كده الصورة جاية ولا في بيعمل هوت سبوت عليها لما بحط النور. Can you see it that way, or is there a hot spot on it? It's okay. Right, so I usually start by right, so as you know, we have 2 tubercles in the lower lip, and we have 3 tubercles in the upper lip. So this is 1 tubercle, this is the second one, and the one in the middle is also a 3rd tubercle. The lower lip, you only have 2 tubercles. I usually never inject this area. It just gives an unpleasant look. And I start my reference with, so this is my Cupid's bow, and this is just the level of the filtrate columns or the filtrate ridges. And this is just mainly my main point. And I do a little trick is I usually just evert the lip upwards like this. And you can see this is the area that moves most. This doesn't move that much. And if she wants a heart-shaped lip, I'm not going to go laterally outside with my injection. So I just move it up like this, and I take a look which part moves the most. And you can see there's very minimal movement here. So I usually stop here. And, you know, after so many years looking carefully, it usually coincides with just the outside of the ala of the nose. And it's always preferable not to go beyond the ala of the nose unless it's really necessary. So the same thing I'll do here. I just lift, and you can see this is the end of where the lip moves. See, it doesn't move that much. It moves mainly in the central part. Even if I do this, see? So this is the part that moves. And if you mark it that way, it's going to be almost equivalent to the other side. There you go. And it's going to be just about the borders of the ala of the nose. I like to do the technique, right? Injection.
fast. And this is my first injection point. I start doing my editing technique, just small streaks of lines like this, to the point where I have marked at the end. There we go. I'm going to do contouring. I never do it from the micro. I just go beyond red line, inside the lip, because if you do it here, then she starts talking. What happens if you find a lip migration upwards? So I mark this, so I know where I'm going to do my contouring, and I usually keep it also in the central part. There you go. And then I start by marking the tubercle of the lower lip. And it's quite obvious here. Here's the tubercle on the other side. And what I need to do is, first of all, I need to plump this area. So I am marking where I need most of my filler to be. Likewise, in this area, I mark where I want my filler to be. I usually don't do more than this. I can do just a little bit outside here for the heart shape to just coincide with the upper lip. Likewise here, just a small injection here, just a little amount. And I've never used more than 0.5 ml for both lips. I don't like people who do a full ml. I've had even clients who came to my office saying that they have done 2 or 3 ml at once, and it's just too much for the lips, right? So finally, what I do is, this is the tubercle of the upper lip, and just in the midline below it, I find it very appealing if you just pinch the lip like this, and this is an oval shape. You get like an oval shape like this, right? You can do it tapered down like a heart shape. And if you inject this area with just a little bit of filler, it gives you that fine definition in between both lips, right? So, there you go. And I'm going to start the injection now slowly. I hope the anesthetic has worked well enough. Let's find out. باين؟ لازم تصعد من فوقيها عشان بتعمل هوت سبوت. So I'm going to start injecting a special filler for the lips. And like I said, one of the tricks I've learned is always push the syringe to push down the first few drops. Because the first push of the syringe is usually not as equal as when you have the filler flowing. So get rid of just the first push, and then everything is going to start homogeneous. And always start from lateral to medial. It's less painful always on the sides than the central part. And just a little bit of a stretch like this, and I go very superficial. I always want to be just below the skin, above the muscle, above the arteries. And if you can see blanching, then this is a good sign. If you want to aspirate, do this. But I'm also injecting perpendicular to where the artery is going. And so I should be safe.
So I just inject very slowly and a very small amount. You can see the filler coming out. And another thing I learned is don't start rubbing the lips just as you have finished, because you're going to stimulate bleeding to occur. I usually do this at the end. See, I'm very superficial. I've got my path, and I stop at the mucocutaneous junction. I don't like to do Russian lips where they go deep. I don't prefer that. Right? So I can just do a little touch like this. I just don't touch the lips now. It will bleed more. So I leave it. Again, just a small touch. And I don't need to ask her because she's not moving in any way, showing that she's in pain. All right, see? If I start rubbing, she will start bleeding. So that's why I just keep everything in place very gently. And I do this at the end. Okay. There you go. Very linear, very homogeneous, just small amounts. And then here's my key point. I usually keep this for last because sometimes it's painful. And just one entry point. I am superficial. I stop at the mucocutaneous junction and I go just very small amounts. Tiny droplets. And come out very slowly. That's it. Okay. I can just compress like this. I compress like this and I leave it and I switch to the other side. No rubbing, no nothing now on the lip until I'm really through. Stretch the lip a little bit, just very superficially. I stop at the mucocutaneous junction and very small droplets. Very, very fine injection. Another thing is when you're coming out with your needle, just come out very slowly, because if you pull the needle out too fast, what happens is it's like the skin flaps just hit each other, then you're going to start bleeding. So just come out very slowly. If there's anything bleeding like this, just press very gently. Don't rub anything now, you'll excite more bleeding. And I'll show you this when we're through. Again, very superficial. I can see the tip of the needle. It's freely mobile. I inject very slowly. I'm looking for any signs of color changes. I'm looking for any signs of severe pain, anything like this. And even if so, it's going to be a very small amount. So it's always better safe than sorry. Again, and just small amounts. So far, I've injected less than 0.2 ml. Okay, there you go. And this is my key point now at the edge of the filter columns. I also stop at the mucocutaneous junction. If you want to do Russian lips, you're going to go below that. Or if you want to do a little bit of a lip flip. There you go again. Very slowly, very small amounts. There you go. See? If there's blanching, then I'm on the right side. And I have one constant pressure with my finger. I don't do a bigger bolus on one side more than the other. Then I take a look from the front view and I see if there's anything that we need to adjust. And I believe this is more than comfortable. And you got this this little hole in the middle just by injecting those tubercles that way. You got this the whistle look of the lip. Some girls do like that. Okay. Look, I see.
Mm-hmm.
See? I just don't touch the lips now. Now, going to the lower lip, I do the same thing, just invert your lip up that. And again, just a mild stretch, just going from here, very superficial. And here's the area I marked when I need to do a little bit of volume. So I'm going to put a droplet here, another droplet here, just very slowly injecting a droplet here. See? And then I'm going to go downwards like that. Just a little. And then from the side, just to match with the border, the maximum border of the upper lip so that we can have this heart shape. I am superficial. I am stopping at the mucocutaneous junction and just a very fine droplet like this going down. That's it. Again, I'll do the same thing on the other side. This is the area I marked where we need to do most of our augmentation. So it's very slowly like this. I go very superficial. I have a free moving needle. Here is the area when I need to plump. So I put droplet, lateral to it, another droplet, medial, there's another droplet. And then I augment the other part of the lip and I'm going out very slowly like this. Complete it again. Laterally to match the upper lip. Here you go. See, you can see there's blanching, there's yellow. You can see the tip of the needle. So I'm mostly in a safe plane and very small amounts, just constant, very fine pressure. And you can see, the filler is coming out. So you don't need to have a lot of force. Then this is my little trick. See, I'm not rubbing anything. I don't want to excite bleeding, so I'm just pushing slowly. Now, this is the trick I've learned, which does add to the shape of the lip. So finally, when I'm through, I just catch the middle part. And here I have this in between both tubercles. I have this lip. I can go just a little bit in the middle, and I go like this. Also superficial. And I put some just between my fingers like that. And see, it gives more of a dent inside here, which is like an Angelina Jolie lip. Okay? So now, this is how much we have used. It's less than 0.4. I've used 0.3 and just a little bit. I've used third of the needle. مش عايزها هتبان؟ Okay. So I've used 0.3 and just a little bit of the needle. That's all I've injected. I don't need to do more than this. Right, now, I'm going to show you something. Once I start cleaning up the lip, look at the bleeding that's going to happen. That's why I don't touch the lips while I'm injecting. Now you're going to find all the spots I've done starting to bleed. See, that's why I leave it to the end, because I don't want to be disturbed during the injection. Right. And then one final trick up my sleeve. I've told you everything now. Now, one final trick up my sleeve is the best thing to shape lip fillers is squeezing the product between the muscle from the inside and the skin from the outside. So what I do is bring a couple of goes like this, and I put it in between her lips. Now, she cannot squeeze her lips inside because she's anesthetized. What I do is I do it for her. So I bring the lips inwards like this. So I'm doing it like that, as if she's squeezing her lips on the inside. Now she's pushing the filler in between the muscle and the skin. And this is the best way to get lip shape. Just a small trick I've learned. And I just want to see it. So I put it like this, and then I flip her lip like that. So now I'm giving her shape from the fillers, and at the same time, I'm compressing so that there's no more bleeding or no more bruising of her lips. Okay, and all I used was, again, 0.3. I don't need more than that. And if you ever want to distribute your filler, it's just very gently. Don't ever push. And always from outside inwards. You don't want the filler to flow on the outside, see? Just very gently. So I'm going to put this back. And I'm going to when I can see everything going on, I just There you go. I'm compressing, and at the same time, I'm giving her shape, contouring, lifting, whatever. I'm just giving the shape of the filler in her lips. You can compress like this for about a minute or so. That would be more than enough, because we haven't done a lot of maneuvers to provoke bleeding afterwards or to provoke bruising. So be as gentle and as minimal with movements of maneuvers as possible. It just keeps everything on the safe side. It keeps everything with less edema, less bruising, less bleeding. You know, she's gonna go out from here. If she has a party to spend outside, she'll do that happily. You know, she doesn't have to go out with swollen lips. Okay. So then we do a final assessment if she needs a little bit of contouring or so. I don't think she needs contouring. Okay. Just gentle touches. Any comments? I think we're done here. Did that hurt you, the haptic? She's smiling, she's happy, she's not swollen, she looks beautiful. I know, but let's set her up and see. تعالى يا شارع عشان الكاميرا ثانية. Right, and what I would recommend to my clients after injection is, for the coming 3 days, I wouldn't like them to sip anything that's extra hot, like coffee or tea. She would have it warm but not hot, because I don't want her to dissolve the fillers, decrease our smoking. And one thing I've also learned in the past few years is this is hyaluronic acid, and substances, food that stimulates hyaluronic acid production, so you have a better outcome and a longer lasting filler, is eat natural products that contain or are very useful for hyaluronic acid. You know, like oranges and lemons and sweet potatoes, everything that is green, you know, from vegetables or from salads, they are rich in hyaluronic acid. And you also find this in some almonds and nutmegs. So I just tell them you don't have to drink a lot of water. This is nonsense, right? So just increase your diet intake of this, decrease your smoking, and stay away from hot drinks for about 3 days, and you're good to go. You still have 2/3 of the needle to inject in further coming months, okay? Now, let's sit you up and let's take a look. Huh? Melo. Okay, وريني. Okay. طبعا كلهم شافوا إلا أنت. Now she's going to have a little bit of a twist of her lips now because of the anesthetic, but when she's stable, I think she's going to see everything quite nicely. In about 1 or 2 days, any edema or swelling from the needle pricks and from the filler are going to subside. And then about 10 days or 2 weeks later, we're going to judge her if she needs to add a few drops here and there. We still have a lot of the product left. Thank you. I'm ready to take your questions now. واحد بس على نفسك قولي لي بقى. Okay, so there are so many questions. So what are the precautions, please? The precautions is, first of all, I start by choosing which patient I'm going to inject, which client I'm going to inject fillers for. I usually tell women who come, who are heavy smokers, who drink a lot of coffee or tea, and so I tell them that you have a less chance of the filler staying long with you than others who really take care of themselves. They eat well, they sleep well, they work out. It's going to stay for a longer period of time. And precaution, just like I said, if you know your anatomy well. If you have a good experience, just inject small amounts, just inject very slowly, very carefully in the right plane. Look for any signs of color changes, look for any signs of pain with the client, and aspirate if you're in doubt, and you're good to go. Right, so the 0.7 ml remaining of the filler, yes, I do inject later on, just keep it in the fridge. I lock it so that there's no infection inside. And it's one of two things. You either use it until you have an expiry date. I usually say I don't open the syringe more than twice. So this was one time. The second time I'm going to use it, if there's anything left, I'd probably choose another area to inject the rest of the filler with. So I only reopen the injection one more time. Otherwise, I just dispose of it. Right, so how long the syringe will last? I just answered that. It will last until the expiry date or until it's opened for a second time. That's it. Which nerves is injected for anesthesia? Well, you definitely the nerves around the mouth. Here you have the infraorbital nerve and you have the mental nerves here. There are special areas where you can check this in dentary books, where to inject exactly where your entry points are above the canines in here and between the canine and the first premolar, but you have to go a little bit inside because the nerve comes from a curvature on the mandible. So there are certain spots for learning this. Okay, when can I prefer Botox for the lip flip? I'm a surgeon. I usually go for surgery with a lip flip. I don't do this with Botox. And sometimes it's very tricky because if you want to do a lip flip with a Botox, you probably, unless you have a big experience with that, which I don't, you're probably going to get affection of the function of the mouth. You're not going to be able, this client is not going to be able to speak properly while achieving a lip flip. So I do it with either fillers, fats, or I just go for surgery. Well, you can ask the academy if they want to send this video for you. So, well, did you like the video, first of all? Did you like the injection technique? Thank you very much. All right, how can we do with cannula? Listen, cannula, in my experience, cannula will just give you softness of the lips. So if you want to do someone who has wrinkles, like the extension of smoker lines, sometimes they call them the barcode lips. If you want to, it's like ironing your shirt. So it's wrinkled and you just want to spread it. You want to give it a homogeneous, smooth look, then use a cannula. But the problem with the cannula is, if you're in the right plane, if you know what you're doing, the problem is you will use so much of the product. Yeah, with a needle, you're going to use much less of the product. Okay, the arterial labia, at what depth are we? I'm just beneath the skin. I showed you, I can see the tip of the needle, I can see the whole needle. If I push the needle upwards, the area becomes white or blanched, which means I'm very superficial. Between hematoma and necrosis when I inject filler, necrosis is definitely sloughing of the tissues. A hematoma is just bruising of this area. You're going to feel something that's really hard and firm. This is a hematoma. I hope you never see necrosis. Which is better, fat or filler? Fat or filler for lips? It depends on what you do. You know, fat is an operation and it needs some certain criteria. So if you take a person who wants to do fat injection for her lips, I prefer someone who is not a smoker, who doesn't have thyroid functions or have like thyrotoxicosis because it's going to burn the filler quickly. Someone with malnutrition, someone with anemia, diabetes. I try to exclude these patients. In this case, fat fillers would be better off for her. Or if someone doesn't want to go into an operation. It's amazing. Thank you very much. You're an amazing audience. This technique is just called it's mainly designed by Julie Horn, which, like I said, learned from Tom Van Eyck. Right? So this is the tenting technique. It's called the tenting technique. Thanks for, you're more than welcome. Thank you very much as well. I don't prefer, asking which filler is better. There are special fillers for the lips. You can find in every company. Now, every company has a name for fillers. You can find, this is for lips. Sometimes they call it the kiss. Sometimes they call it red. No, there are special fillers for the lips. The important thing is just know your anatomy, what you're going to do, what you want to treat, where to place your product, and always under inject, right? Even in Botox, because you can always add more. but you can never take out, and taking out is just loss of money. And I say this just as an example with food. You know, if you put salt, you can always add more to your taste, but once you have too much salt, you're going to dump the food away. Okay. How can we correct the M shape? But I can talk about that one other time because there are a lot of details in that. So what is the best type of filler? It's just asking what's the best type of car. You know, some prefer Mercedes, some prefer BMW, Porsche. I don't know. There's nothing called the best filler. The best filler is what works best with your hands safely, and you can get the best results out of this. I don't want to talk about specific fillers. Maybe I don't have that much experience with Juvederm, but like I said, whatever product you're safe and you can produce good results with, then it's go on for it. And of course, it's affordable with the patient. You're more than welcome. How to avoid bubbles when we do superficial? I don't know what you mean by bubbles, but bubbles are usually if you inject air. But even if you have small bubbles, that means you have gone so superficial, injected big amount, and injected probably in the mucocutaneous junction, beyond the mucocutaneous junction. You know, just rub it firmly a little bit, and that's it. It will go. Or apply some hot foments, it will dissolve it. Can I inject 1 ml? You can do whatever you want. You can inject more than 1 ml, but you know, don't expect amazing natural results if you inject more than that. What is the size of the needle? I usually prefer a 30 gauge needle. Sometimes I use a 29 gauge needle. I don't like to go for bigger size needles because I don't want to do a lot of hematoma or pain. That's to inject to resolve. Well, if I used 0.3 ml, I think I don't need any hyaluronidase to dissolve it. I just dissolve with some hot foments. And please, as a piece of advice, never use hyaluronase or hyalase unless you're treating an emergency. So if someone comes to my office and says, I don't like the fillers, I want to dissolve them. There are so many different ways of getting rid of the filler, but I don't use hyalase except in emergency conditions. You know why? Because number one, it's really hypersensitive. I have to do sensitivity test for clients. If you inject it without doing a hypersensitivity test, you might go into an anaphylactic shock. The second thing, it not only dissolves the filler, it also dissolves the structures, you know, the collagen in normal tissues. And then what happens is you have shrunken tissues, just loss of tissue. So like I said, I don't use it emergencies, and I would never like to use it unless it's an emergency case. You probably inject it inside an artery and there's going to be a problem. But otherwise, I'd never use it. Keep the remaining filler. I've answered that question. How many days can we keep the remaining filler? We can keep it as long as the expiry date is on, or if you open it one more time. I usually don't open it more than twice. The swelling of the lips will go down in a few days. So no. You think 0.3 ml is going to be invisible? Of course not, because it's in the right plane and it's, you know, she lives healthy, she eats well, she's going to follow the instructions. You'll be surprised how much those 0.3 ml will stay. My pleasure. Does injecting the contour of the lips make it migration? Only if you inject it in the wrong plane. If you inject lip contouring in the wrong plane, yes, it will migrate. So it's always in the red line, just below the red line, never up. I see a lot of people doing contour upwards and then it migrates towards the nose. No, never. It's always inside the lip. Right. What is a trend? There is a trend with longer needles. What do you think about that? Well, how long a needle do you need to go just from here to the mucocutaneous junction? I think this is silly. You know, if you go with long needles, so what are you going to gain? I've seen people inject this with even shorter needles, you know, like the ones with the insulin syringes, and they produce amazing results. How do you treat sad look at the corner of the mouth only? Well, I definitely treat sad look at the corner of the mouth. I prefer to do botulinum toxin because you know where the depressor anguli oris is, and just by relaxing this muscle, then you have the muscles at the modulus pulling the angle of the mouth upwards. You can add a little bit of touch of fillers here, or even at the corner of the lips. But I'd start off first of all with botulinum toxin injection, but be very careful not to inject the depressor labii inferioris, because then you have a big problem with your clients. What are these other methods to remove fillers? I've had a client who came to my office. She had injected fillers for less than 24 hours. I just put a small trocar, I poked the lips, and I squeezed the gel out of her lips. You can squeeze the gel out of the lips, I think, for about 5 days. I've had this with my personal experience. But hot foments will do the trick. Hyalase, of course, on the other hand. Okay, so how to access what's best for each patient, how to assess what's best for each patient. Again, it's what she wants and what you can do. But the best thing I'll tell you about is always ask your clients for pictures a long time ago when they usually saw themselves in the best shape, or the best way. So tell her, you know, you used to like what you looked like, whatever your face, a special part of your face, your lips, 5 years, 6 years, always go back to the basis of your client. Just let her look herself, but a few years younger, looking fresh. Don't make her lose her identity. I don't want some coming to me, you know, she always had fine lips, good looking lips, matching her facial contour. And then she asked for Russian lips where suddenly her lips are just poking out of her facial features. The best thing to do is just bring your client back to the older her when she was looking about 10 or 15 years younger. That's the best thing to do. After what time we repeat the rest of the filler? It differs from one person to the other according to how much you live a healthy life. So then you keep the filler for a longer period of time. I've had people who've come to do a refill with their fillers 3 months later. I've had clients who came to my clinic 11 months later. You're more than welcome. Some doctors bend the needle. Why they do this? I don't know. You can ask them. But if you know your anatomy, like you saw, I was stretching. Everything was so accessible. I didn't need to bend the needle. But again, if this makes him feel more comfortable, then and he can do and he can produce good results safely, then why not? Bend your needle. I don't care. You can do whatever you want. See, this is one good thing about medicine and about surgery in specific. You know, there's no rule in medicine. Whatever you can do to achieve safe, perfect results, just go on for it. I don't care if you even, you know, take the needle off. If you can do a good result that way, I don't care if you even, you know, take the needle off. Doctor, how can I control that I do not leave the filler on the lip and most to the upper lip so it does not become a notebook between the lip and the nose? Again, it's under inject and then add a little bit more. I always give about 2 weeks between each, every time I inject and then reevaluate the lips. 2 to 3 weeks, right? Then I think you're going to avoid anything you're afraid of. You're so intensive. Thank you very much. My pleasure. My pleasure. I've also had a few more questions here. How to deal with injection complications. I think the best way to deal with injection complications is to avoid them in the first place. So avoiding complications by knowing your capabilities, what you can do, knowing your anatomy very well. Now, taking care of these small fine tricks, then you're always safe to go. And then if you have any minor complications, then you can always massage the area, rub it off, use Hyalase if you're talking about fillers. But let me tell you that the complications of injection does not only include real complications. You know, if a lady comes to you and says, I don't like the way I look, the lips are not symmetrical, the filler has gone so quickly, I'm bruised. These are all complications you have to deal with, you know. Just a complaint from your lady client is a complication on its own. Right. The best way to treat vascular occlusions of the lip, hot fomentations. Some people say, you know, compress the vessels with ice. Some other people say use hot foments, open, you know, open the vessel so you can wash out the fillers. Like I said, again, just avoid injecting into a vessel. That's one thing. This is the best way to prevent it. The other thing is, well, just use Hyalase, that's it. How to fix lip complications after facial palsy? That's a very interesting question. Are you treating function or shape? You know, so if you're treating shape, then go for fillers, go for fats, go even for surgery. If you are treating function, you can do one of two things. You can either inject Botox on the opposite side, the normal side, so it becomes weak like this one, so you don't have a lot of asymmetry, you have a little bit of harmony. And you can also do, we have a lot of operations to do, like correcting the angle of the mouth, and so like adding a sling, as well as sling operation, so many things to do. Right. How to avoid lip filler complications, we talked about that. Needle versus cannula, we talked about that. Yes, that's a very good question. Does the anatomy of the lips change with age? Yes, of course it does. Two things happen, and they are different between the upper and lower lips. Generally, the lower lip tends to roll inside. I see this with a lot of older people, and it tends to, for the upper lip, it just relaxes downwards like a closed lips, and it becomes very thin. So for the upper lip, I like to do, you know, we call it the bullhorn incision. It's sometimes they call the bird wing operation. So you take off a little bit of the upper lip, and then you have the lip is switched upwards. Then you can also plump the size by injecting fats or fillers inside. The lower lip, the problem with the lower lip is the incision with the upper lip is usually hidden here underneath the ala and the nostrils. So it's hidden, but with the lower lip, it just has to be just below the lip. I don't prefer to do it. I just do, I'd probably just do a plumping of the lower lip, and that would be it. So any signs and symptoms of allergic reaction or infection following lip fillers? Well, you can always ask them if they do have any allergic reactions to previous injections with fillers, and if so, just do a test. If she has minor allergic reaction, you know, she can, the night before, the night after injection, she can take any antihistaminic drugs, maybe some anti-inflammatory drugs, but small amounts, maybe small amounts of cortisone if necessary. But if infection, this is not going to be from the filler. Probably infection is from not sterilizing the area properly, so that you introduce the injection with injecting the needle. And injections are always treated with antibiotics first. And if an abscess is formed, then you have to drain it. That's it. What about filler migration of the lip? What's the best way to do? Well, again, if it's just simply migration, I would leave it until it dissolves. You know, apply massage, hot foments, the filler would go quickly. Otherwise, just wait and try to avoid it the next time. Don't use Hyalase for dissolving a filler that's only migrated unless it's really, really bothering her and it really looks ugly and a big amount. If it's just a contour of the lips, then it's no problem. She can hide it maybe with some lipstick and that's it. No, never do injections with pregnant women. Never, please never do that, because there is no official document to say that filler injection, Botox injection, anything has direct relation to do with a possible abortion, God forbid. But if it just happens by chance, it will always be blamed on the doctor because he injected this substance. And all textbooks say we don't have any proof that fillers might affect the labor, might affect the child, a pregnant woman. But everyone says avoid injection during this period. You know, let her deliver. You don't have to go for fillers while she's pregnant. Let her deliver and then come and do her fillers later on. You don't want to take the risk to going to court because you have injected and she got an abortion. She's going to have abortion from any other reason, but you're always going to be blamed, and no doctor is going to stand with you because all textbooks forbid injecting during the pregnant time or pregnant zone. Well, lactating women, that's no problem. No, lactating women can have fillers and can have Botox, not pregnant women. As long as the child is safe in her hand, there's no problem. Okay. Thank you very much. I hope I have benefited you in some way, we can probably meet somewhere on planet Earth anytime, and it will be a pleasure. You're more than welcome. You can give steroids, yes, in severe reactions. But again, it's always better to avoid than to treat. Everybody, you're more than welcome. Thank you. It was my pleasure being with you.
Hello and welcome everyone again after this insightful educational video demonstration and Q&A session with one of Egyptian aesthetic icon, Professor Ahmed Sharif, Professor of Plastic Surgery, Faculty of Medicine in Shamsia University, and one of member of Egyptian Society of Plastic Surgery. Thank you, Dr. Ahmed Sharif, really. It was an insightful and amazing lecture, and thanks for all our attendees for this amazing conversation and interactive. And now with the last session in our hub session was Professor Patrick Tracy, one of the best plastic surgeons in Ireland. Congratulations, Dr. Patrick, took the best plastic surgeon in Ireland this year. Professor Patrick Tracy, Professor of Dermatology, Fellow of Cosmetic Surgery, the aesthetic practitioner in the world in 2019, as well as Fellow of Aesthetic Medicine, on one of the first pioneer of the field of aesthetic medicine. And now I let you with an amazing lecture about the complication of filler. Actually, Dr. Patrick Tracy is not present nowadays because he is in South Africa, but he recorded the lecture and we will present it now. So let's start the final lecture. Okay, I'll let you with another informative lecture.
Hello, my name is Dr. Pat. Global Aesthetic Summit. This is a wonderful idea. And for all of us that are just joining aesthetic medicine recently and seeing the problems, particularly with delayed onset nodules or also vascular occlusions, let me tell you these and other problems of a much bigger scale. So what I'd like to do, I suppose, in this lecture is to take us back over the last 20 years of dealing with aesthetic complications. This is a very interesting photograph. This was taken at the Royal Society of Medicine recently, where I was chairman of the Congress. And you can see two of the people in this photograph have got hemifacial autologous transplants. This lady, you can see, with her cheek, and this lady with her forehead. And I'll go into that in a moment. So this is my biography. Over the last 3 years, I've won, I suppose, a lot of awards and medals in aesthetic medicine. And we can pass on through that to 20 years history of complications. Where are we now? Hyaluronic acid fillers. So as a consequence, because I'm dealing with complications, she in something 48 hours. This is a patient I've seen very recently. She was sent to my clinic with this type of reaction, and even though you see these pictures posted all over the papers, this is quite easy to treat. It's a hypersensitivity reaction. This patient had angioneuralgic edema as well, so in her history. So I thought it was preferable to give her some adrenaline as well as some steroids. And by the time she'd reached home, which is about 3 hours from Dublin, her problem had cleared up. Again, I don't want to mention compounds, but I suppose I have to an extent, because these were the problems that we had, and these are the problems we grew up with. This patient here had granulomas in her face. I don't want to stay on our images for too long, because I'm aware that this is an aesthetic summit that can be picked up on mobile phones. And her granulomas had to be treated. Now, the polylactic acids, unfortunately, if you put them into circular muscles, then they could precipitate out crystals. And this caused a lot of problems at the time. Next patient was from Spain, and at this one, the world was facing a crisis with HIV, that it still is, but I suppose less focus has been put on it by the newspapers. And at that time, I suppose the only treatment for HIV lipoatrophy, and we didn't know at that stage whether it was going to be as a consequence of patients living that long with their illness, or whether it was secondary to the side effects of the medicine. So I'll just run into a little bit of the history of the time. At the time, you can see that I was writing sort of some articles on HIV, and if anybody reads my memoir, they will see my particular interest in that disease, particularly in Africa. So we were treating the patients with HIV lipoatrophy with Sculptra or the polylactic acids. But we had three big problems. The first thing is that we couldn't trust the medical reports that we were getting in from different countries. They were all saying it was the CD4 level was fine, and that the viral load was negligible, that they weren't infectious. But the second problem, of course, was that to do Sculptra at the time, they needed 5 treatments. And the third thing was, because as anybody that has used Sculptra knows, the needles stopped blocking all the time, so you increased your risk of a needle stick injury from HIV dramatically. These patients needed up to 100 injections within the dermal layer, and as a consequence we had to come up with a new way of doing it, because at the time there was recognized needle stick injuries, and we came up with BioAlchemid. BioAlchemid was a product of the period, and we treated HIV lipoatrophy. I've had to reduce. I include this only because this is Dr. Alex Catino, who is head of the task force in Africa for HIV from Makerere University in Kampala in Uganda. And Bono had gave him the United Nations Humanitarian Award for his work in Africa. And I got to know Alex at that time. And because we were seeing so many HIV lipoatrophy, I really wondered, was it the drug or was it a progression of the disease? So at the time, I had looked at Alex's work, and this is some contact we had together back now 14, 15 years ago. And so when I went down to Uganda, I realized that the patients I was seeing there didn't have this condition. It was very much a Western condition. So I presumed, or I advocated at the time, that it probably was the drugs that was causing it. It was later proven, probably about 2006, 2007, there was the peroxide radicals of the antiretrovirals. And as a consequence of that, new drugs came out which didn't cause that transposition of fat. But at the time, it was a big period problem for us. This is the first patient I treated in the United States with BioAlchemid. A wonderful guy. He went on a cruise liner after that. He'd been socially isolated in a room for 4 years, and I believe he may have even got married in that period, but I'll sort of move on. So this is a paper I wrote in the British Journal of the Journal of Derm Surgery at the time, where we had taken, I can't remember at the time, maybe 11 subjects with HIV, and I wrote a paper on BioAlchemid, and it made it so easy because you could treat the patient in 1 day, the compound lasted for life, and the patient didn't have to come back, but life wasn't all that easy. As you know, The next problem we had that bioalchemid started causing steroid facial abscesses, quite dramatically actually, and some of the patients we didn't see until 10 years later. The compound has now been taken off the market, particularly after the Canadian board had made complaints against the company. So this is one of the patients, and this is the way I suppose we could treat them. So when the compound presented, it presented like this, and you can see when you point it, you can see that it's white, and just nicked it, and the product came out. So we had so many of these patients to treat in this period, particularly
removal of bioalchemid from the face. You can see that it's usually underneath the skin, and it's easy.
So then I was invited to Moscow as one of the first, I suppose, lectures back in after communism had ended. And when I was there, I was lecturing on that period where we had fibroblast transplants under Esologen, another compound that has been pulled off the market. And at the time, I noticed that we were having a lot of doctors coming to me with problems with bioalchemid, Aquamid, and also we went through this period of nodules in people's lips, 2004, and so there was quite a lot of these, including infections. So just because people are seeing now all these problems with lips, believe it, we had it 15 years ago, if not 20 years ago, and you can see lots of different things. Again, I wrote a paper on this, advocating that polyvinyl should not be used in lips, and I wrote up again some papers on this. Now, at the time also, I noticed that Radiesse was causing problems in lips, particularly, and I advocated that maybe it should not be used in the perioral area at all, particularly the perioral commissures. So this is us in 2007 at the Seafield Conference, where I advocated two things: the use of, I suppose, lidocaine with Radiesse because it was a painful compound, and also to not put it in the glabellar or in the perioral area that we're experiencing now. So case 10 was removal of hyaluronic acid. So nobody really had used hyaluronidase to remove it, but we were using it 15 years ago, back in 2005. And at the time, I had written protocols for Hyalase, which are very important now. And this is a period, I suppose, where dermafillers were showing problems in patients, particularly if they went into the angular artery, the ilar artery, branch of the facial artery, all the way up, with a potential even in later years to cause blindness. So at the time, Arnie Klein, the late Arnie Klein, who is still alive, was treating Michael Jackson, the late Michael Jackson also, and he had put a little bit too much fillers in the face, and as a consequence, Michael needed it taken out. And I suppose most people know that he flew across the Atlantic and we had to take it out. I only mention him during the lecture because, believe it or not, he was one of the first patients in the world that hyaluronidase was ever used on. As well as that, when we contacted QMed at the time, who made the product involved, they had no protocols and they knew of nobody that had actually used it to reverse overfill of a hyaluronic acid filler. So after that, hyaluronic acid was used for breast implants, and this was a wonderful compound. You could actually do a breast in something like 10 minutes, and it would last, at the time, if I remember, up to about 18 months. I was using it for some more interesting things, like pectus excavatum, and you can see this patient here with, I suppose, the heart involved to an extent. You can see how it was, I suppose, moved within the thoracic cavity as a consequence of the pectus excavatum, and without letting the patient's pictures be seen, I was using it more medical than cosmetic at the time, but it caused its own problems. So then the vascular problem started, and particularly the vascular problem started because most of the fillers we were using were non-reversible. So this is a patient I don't want to harbour on them that I had seen at the beginning of this journey. And then I was writing a paper on using dermal fillers for atrophic scarring, and this is a patient of my own. I had this little bleed. Within a small period of time, it had gone into this reticular pattern formation where you had hyperemia, and within a very short period of time, a few days, you could see this crusting, and this patient thankfully recovered totally. Possibly the transverse facial artery involved by the So Melina normally comes for some fillers. This particular filler seems to have lasted quite a long time. So what we're going to do today is more something we've been doing for quite a while actually, and that is a lip flip. Now when I say we've been doing it for quite a while, I know it's become favourite recently, but if you take the orbicularis muscles, either the one around the eye, orbicularis oculi, orbicularis ori, when you consider that these muscles are quite big and prominent, so if we temporarily paralyze part of it, then the rest of it is going to come into action. And we did this many, many years ago, believe it or not, with blepharospasm. I think we're the first clinic that I ever know, certainly, to do it where when you had a patient with practically almost closed eyes, if you just went in above the eye lid, just where the, I suppose, the hair follicles are, and just put in a little bit, instead of dropping it, it opened up the eyes. And I performed that for the first time in 1999 actually, with a patient who has passed on since he was a famous artist. And technically we're doing the same technique within the lip. So if we, I suppose, almost like a filler, put a little bit into the vermilion border, and then the upper part of the lip will cause this part to flip out. Now, this becomes important, particularly with those type of patients who have got a requirement for a lip lift rather than lip augmentation. These patients normally would require surgery. So if the philtrum is more than 1.7, some of them are up to 2. And if you excuse me, Miranda, I'll just get a ruler. So normally we measure this length, and it's totally normal with Melina, it's only 1.5, but some people have it greater than 2 and they've got an everted lip. And those patients, there's no point in putting fillers in them, because in some ways what you do is drive maybe the lip to invert more, and those are patients that require surgery. So these are perfect patients for flipping lips. So I predict that this will become very popular, particularly there's I suppose recent fashionable move by some celebrities and some influencers to move away from fillers, and this is one of the ways it'll go. So without further ado, we'll do the rest of Melina's Botox. Thank you.
Thanks, Professor Patrick Tracy, for this amazing and tips and tricks and all information about filler complication. Actually, we finished our webinar. So, dear instructor and attendees, on behalf of an American Association, my sincerest gratitude for your participation in the webinar. Your presence and active engagement made the event insightful and successful. To our instructor, thanks for your sharing your expertise and this insightful lecture. Actually, I'm speechless. It's an informative webinar filled with a lot of things. For our attendees, thanks for your participating and for everything and for your valuable comments. You will receive your attendance certificate from American Association as soon as possible. Again, I want to thank all of you and see you soon in another webinar. Stay tuned for a series of webinar, free online webinar to know more about the aesthetic medicine and to know the latest update in the latest guideline. I'm Dr. Mariam Riz, I'm medical coordinator and trainer. See you in next webinar and bye-bye.